What if your blood pressure is not the real problem? What if it's the alarm? You could spend years treating the number, more medications, less salt, more frustration, while the real cause, pushing your pressure up. And sometimes your body shows the clue on the outside: a thick neck, a rounded face, purple stretch marks, bulging eyes, bigger hands and feet. These may be visible signs that your high blood pressure has a hidden cause. I'm Dr. Columbus Batiste. I'm an interventional cardiologist and a lifestyle advocate. Yes, I open blocked arteries. But my deeper mission is to help you prevent the damage before you ever need me in that room. Now listen closely. You cannot diagnose high blood pressure by just looking in the mirror. The only way to know your blood pressure is high is to measure it correctly. But once you know it's high, especially if it's hard to control, severe, sudden, or showing up at a younger age, you need to ask a better question. Why is my blood pressure high? Most high blood pressure, it's called primary hypertension. And that means there is not one single obvious cause. But some high blood pressure is secondary hypertension. And that means something else is pushing the pressure up from underneath. Sleep apnea, too much cortisol, thyroid disease, adrenal tumors, growth hormone problems. And sometimes the body gives us visible clues on the outside about what is happening on the inside. So as I go through this list, don't look for just one sign. I want you to look for patterns. One clue that may mean nothing, but a pattern that can change everything. Now, let me give you an example. I want you to think of a friend of mine. His name was Tom. And Tom, he had high blood pressure for years. When he went into his provider, every visit sounded the same. Tom, eat less salt. Tom, lose weight. Tom, I want you to take this medication. And those things can matter, but nobody asked the deeper question. Why is his blood pressure so hard to control? And then someone finally looked at the pattern. Tom had a thick neck. He carried more weight around the upper body. His airway looked crowded. His blood pressure stayed high even when he tried to do the right thing. That visible pattern, it raised a different question. Could sleep apnea be driving this? That is the point of this video. Sometimes the blood pressure number is not the whole story. Sometimes the body pattern is where you have to look. I'll tell you, one sign is interesting, but a pattern, it's powerful. Have you ever been told that your blood pressure is high, but no one explained why? Type Y in the comments if that happened to you, especially if your blood pressure's been hard to control. Now, the first visible sign is a thick neck or crowded airway. This may point towards obstructive sleep apnea, and sleep apnea is one of the most overlooked causes of stubborn high blood pressure. Here's what happens. At night, the airway actually collapses, oxygen drops, the brain senses danger, and stress hormones, they surge. Blood vessels tighten, blood pressure spikes, and then it happens again and again and again, all night long. So a person wakes up thinking, I had a good night's sleep, but their cardiovascular system has been under attack for hours. Now, what can you actually see? A thick neck, fullness around the throat, weight carried higher in the upper body. And when the person opens their mouth, the airway, it may look crowded, like the back of the throat is so hard to see. Now, this doesn't mean that every person with a thick neck has sleep apnea. And thin people, they can absolutely have sleep apnea. But if blood pressure is high and hard to control, this is one of the first hidden causes worth asking about. The visible clue? Thick neck, crowded airway, upper body weight pattern. The question to ask, could sleep apnea be driving my blood pressure high? Now, don't skip this section. It's equally important. The next few signs are not separate diseases. They're actually clues that can stack into one major cortisol problem. Now, one alone may mean very little, but together they may point towards Cushing syndrome. And Cushing syndrome happens when the body is exposed to too much cortisol for too long. Now, cortisol is often called the stress hormone, but it does way more than just stress. It raises blood sugar, it shifts fluid, it changes where fat is stored, it affects blood vessels, and it can push blood pressure higher and higher. Now, the visible pattern is not just weight gain, it's the shape of the weight gain. The face becomes fuller and rounder. The belly and the trunk, they become heavier. But the arms and the legs, they may look relatively thinner. And fat may collect at the base of the neck, across the upper back, or even above the collarbones. But this is not about body shaming. This is not about appearance. This is about recognizing a medical pattern. A rounded face alone does not mean Cushing syndrome. Belly weight alone doesn't mean Cushing syndrome. Upper back fullness alone doesn't mean Cushing syndrome. But high blood pressure, plus a rounded face, central weight, and upper back or collarbone fullness, now you have a pattern worth noticing. Number 3 is wide purple stretch marks. Now, doctors, we call this villous striae. Now, these are not the typical thin, pale stretch marks that many people get from growth, pregnancy, muscle gain, or weight changes. These are different. They are often wider, they're deeper, red, purple, or dark purple, and they may show up across the abdomen, the thighs, the hips, the breasts, or the arms. So why does cortisol do this? Because too much cortisol can weaken connective tissue. The skin becomes thinner, more fragile, easier to tear. So the body shape, it changes. The skin stretches and forms these broad purple marks. A faint stretch mark by itself is usually not concerning, but a wide purple spreading stretch mark in someone with high blood pressure, rounded face, central weight, and upper back fullness, this is no longer just one finding. This is a cluster. Now, this last cortisol clue is the one people often dismiss. New coarse hair growth or sudden acne-like skin changes. They can also point to hormone imbalance. Now, the medical term for coarse hair growth is hirsutism, and this means darker, thicker hair showing up in places that are unusual for that person. The chin, the upper lip, the chest, the abdomen, and the back. On its own, this can have many causes: genetics, medications, polycystic ovarian syndrome, or other endocrine problems. But here's the key word: new. If new coarse hair growth or new acne-like changes appear alongside high blood pressure and the cortisol pattern we have been building, rounded face, central weight, upper back fullness, wide purple stretch marks, then hormones belong in the conversation. The better question is not what is wrong with how I look. The better question is, could my blood pressure be one piece of a larger hormone problem? The visible clue: new coarse hair growth or acne-like skin changes, especially in context. And here's the rule: one sign is interesting, but a pattern is powerful. Number 5 is brown skin patches or multiple soft skin growths. This one connects something rare but important: pheochromocytoma. Now, pheochromocytoma is a tumor that can release adrenaline-like hormones. Those hormones can drive blood pressure up, sometimes constantly, sometimes in sudden spikes. Now, most people talk about pheochromocytoma through symptoms: a pounding heart, sweating, headaches. But this episode is focused only on visible signs. So what can you see? Well, one clue is cafe au lait spots. Now, these are flat, light brown patches on the skin. Now, the name means coffee with milk because of the color. Another clue is neurofibromas, and these are soft bumps on or under the skin. Now, let's be medically precise. Cafe au lait spots and neurofibromas are not signs of the tumor itself. They can be signs of an underlying genetic condition called neurofibromatosis type 1, and this can coexist with pheochromocytoma. Now, don't panic. One brown spot doesn't mean that you have a tumor. One skin bump doesn't mean that you have a dangerous condition. But multiple cafe au lait spots plus multiple skin growths, especially in someone with unusual or difficult to control high blood pressure, it may suggest a genetic condition that deserves a deeper look. Now, the visible clue, once again, several light brown patches plus several soft skin growths. Not one spot, not one bump, a pattern is what we're always looking at. Now, number 6, it shows up in the neck, the eyes, and the hands. This points us towards the thyroid. And the thyroid gland, it sits in the front of the neck. It helps control the metabolism. So whether the thyroid is running too fast or too slow, it can disrupt blood pressure. But the visible clues may look very different. Now, if the thyroid is overactive, the body is running too fast. And you may see swelling in the front of the neck. That is called a goiter. The eyes may look wide, prominent, and staring. The upper eyelids may look pulled back. And if the person holds out their hands, you may see a fine tremor, a subtle shaking. Now, on the other side, if the thyroid is underactive, the body may slow down. Now, one visible clue, it can be puffiness around the eyes. So thyroid problems can leave visible clues in 3 places: the neck, the eyes, and the hands. No one has every sign, and these findings can have other causes. But if high blood pressure shows up with neck swelling, staring eyes, trembling hands, or puffy eyes, the thyroid belongs in the conversation. The visible clue: neck swelling, prominent eyes, hand tremor, puffy eyes. Number 7 is slow enlargement of the hands, the feet, the jaw, or the brow. And this can point towards a condition called acromegaly. And this happens when the body makes too much growth hormone in adulthood. So you're no longer able to grow taller. So instead, the excess growth hormone, it changes soft tissue, bones, hands, feet, and facial structure. The hands may get larger. The rings may stop fitting. The feet, they may enlarge. The shoe size may creep up. The jaw may become heavier. The brow can become more prominent. Facial features may look coarser. But here is the most important part. The clue is not just how someone looks today. The clue is change over time. Acromegaly, it moves slowly. So slowly that family and friends may not even know this. But old photos, they reveal the story. That's not vanity. That's medicine. If blood pressure is high and the hands, the feet, the jaw, the face have gradually changed over the years, that's worth bringing up. Now, the visible clue, bigger hands, bigger feet, heavier jaw, prominent brow, changes over time. Now, before I recap, save this list. These are not diagnoses. These are just conversation starters. Number 1, a thick neck or crowded airway. I want you to think sleep apnea. Number 2, a rounded face, belly weight, or upper back fullness. Think cortisol pattern. Number 3, wide purple stretch marks, a skin clue from excess cortisol. Number 4, new coarse hair growth or acne like skin changes, a hormone clue people often dismiss. Number 5, brown skin patches or multiple skin growths, rare but important genetic clue. Number 6, neck swelling, bulging eyes, puffy eyes, or a hand tremor, a thyroid clue. Number 7, bigger hands, bigger feet, larger jaw, or a heavier brow, a growth hormone clue. Now remember, these signs do not prove high blood pressure. They do not diagnose the cause, but they're clues, visible clues. Now, once high blood pressure has already been diagnosed, they may help you ask, is this primary hypertension or is something else driving it? Because sometimes high blood pressure is not the disease. Sometimes high blood pressure is the alarm. And the visible signs, they're just the smoke. So don't diagnose yourself. Measure your blood pressure correctly. Look for patterns and bring those patterns to a clinician who can evaluate the whole picture. Now, send this to someone whose blood pressure stays high despite doing everything right. Because the missing question may not be, what else should I take? It may be, what is driving this? As an interventional cardiologist, I've seen what uncontrolled high blood pressure can do. Stroke, heart failure, kidney disease, atrial fibrillation, and blocked arteries. But the goal is to catch the clues before the damage is done. So I need you to look deeper. I need you to ask better questions. And I need you to remember, one sign is interesting, but a pattern, it's powerful. The body often whispers before it screams. All right, I want you to always remember, if you want to go fast, go alone. If you want to go far, go together. Let's go far together by building healthier hearts and stronger communities. So like it, share it, send it, save a life. And I'll see you next time.